Hi guys, in this video I'm going to chat about load management and relative rest and how you can use that concept to help you stay as fit and as active as possible while you recover from an Achilles tendinopathy. So for those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your Achilles injuries. Link to the website is in the description of this video. Okay, so what's load management and what is relative rest? To understand that and how that helps recovery, it's good to understand first what happens in your tendon when you have an Achilles injury. So essentially, when you've got a tendinopathy or tendonitis, whatever you want to call it, you have a structural issue in the tendon. That's a part of the tendon has changed its shape, and that part is not as strong as it used to be. Now we can strengthen it back up, but it takes quite a while. So what we need to do is, with relative rest, is we need to figure out how strong is the rest of the tendon? How much load can it currently handle? Because the reason you're getting pain with your walking, your running, and your racket sports like tennis is because the load in that sport at the moment is too much for this injured tendon to cope with. So it keeps on flaring up and getting a little bit worse. Now, it's important to understand that complete rest, so where you do nothing for weeks and weeks and weeks, can make the pain feel better, but it won't change that strength. And in fact, it may even make it a little bit weaker still. Because think about it, if you are really fit and healthy and you lie on the couch for 3 to 4 weeks, you don't really move, you don't really do exercise, you lose your muscle tone. Now, it's not just muscle strength you lose if you don't do stuff. Your tendons, your bones, everything loses a bit of strength because the body goes, or the brain goes, oh, you don't need to be so strong. We're not going to waste energy on that. And that's why it's important to stay active, but within the limits of your tendon strength, because then we're preserving as much as possible. So what do I mean within the limits? So it means that we identify the activities that cause you pain. And when I say the activities, it's not just your sport. It's often that people are doing other things in daily life, like the amount they walk, the stairs climbing, jumping off something. Anything that uses the Achilles tendon can potentially also contribute to overloading it if there's too much of it in the day or it's just too strong for it at that moment. So part of what we help you do is analyze your day and your week and your training and everything you like to do. And then we identify what level is okay for the tendon to continue with. And we will use pain cycles or monitoring your pain and how it reacts to different activities to figure that out, as well as some strength tests. Now, Alison did a video before about how you can use pain as part of your rehab to guide yourself. And I'll put a link to that in here or in the description of this video. So once you've figured out what activities you can continue with, then that's part of your rehab. So then we tailor your strength training as well to that level. And as you get stronger, you can add some more strength training, some more walking, some more running, some more whatever you want to be doing, tennis. Now, sometimes that Achilles tendon may be so painful and may be quite weak that you can't continue to run for a while. And it's usually the guys who's neglected it for a while and you've had it for more than 3 months. So often the patients who we see have a history of having had pain in the tendon for more than a year. Now that tendon needs a little bit of a break. It needs to build a lot more strength before you can get back to your running and your tennis. But other guys who's only recently developed a niggle, and it's only a little bit of a niggle, it's not really such a painful tendon, and they have good strength with their heel raises, they may be able to continue running or walking several times a week. So it's about the individual, and that's what we can help you do. We don't just prescribe, Achilles tendinopathy, you do this for each patient. We look at you, we look at what you want to be doing, what your normal is, and we adapt your program for you with regards to that. So have a look around the website. Let me know if you've got any questions. And if you need more help with your Achilles injury, you're welcome to consult one of the team via video call. Link to the website is in the description of this video. Take care.